So now we are going to demonstrate to you the collection of urine sample from a catheterized patient. So what we have got here is a urinary catheter. I think you would have seen in the wards also that this is the usual catheter, and this is the tip. This will be inside the patient's bladder, and this will be the part that is coming out, and into this we collect the tube and the bag. So the bag also has an end which you can open and remove the urine. So this is like a clip which will keep the urine inside the bag. As long as this set is in one continuous path, this is a sealed pack. So therefore other organisms will not come from outside, but the organisms that are colonizing the urine will be remaining inside the bag. So they will collect inside the bag, and therefore the bag and the end of the tip is not a good place to collect urine, and this tube also not good to collect urine from, because these are all can be contaminated. And if you try to punch the needle into this tube, it's very difficult as it is very hard, and it might damage the tube also. You might need to change it thereafter. And this end, the catheter is inside the patient. There is a part here also. So if you try to collect urine from this end, you might get into trouble, because this end has two channels. So from here there are two channels inside the catheter. So there is a larger channel through which the urine passes, and there is a smaller channel where you inject distilled water into this one and inflate the bulb at the tip of the catheter to retain it inside the bladder. So therefore the best place to collect urine is just below the bifurcation, this point. So just below the bifurcation you can collect urine from this place. So what we are going to do now is to demonstrate to you how you should collect a sample. Before you collect a sample, you have to wash your hands thoroughly with soap and water, and then you need to clamp the catheter to collect the sample of urine. What we are going to do is to clamp it now. Now we are going to put a clamp, and when you clamp the catheter, the urine will collect inside this tube. So you have to wait about 10 minutes until the urine collects inside the tube. Then you have to wash your hands again and put on clean gloves. So now we are going to put on clean gloves, and we don't need to wear sterile gloves for this procedure. So you can do with clean gloves, and then you take a swab of cotton and soak it with 70% alcohol. So now we have a swab soaked with 70% alcohol. So now we have selected the site that we are going to clean. So this is the site that we are going to clean, and we have to clean it for 30 seconds, because alcohol will take some time to act, and we are allowing that time for alcohol to act when we apply it continuously for 30 seconds. So clean in a concentric manner don't touch the other areas of the catheter. So once the 30 seconds are over, we leave the catheter to dry. Now you can see that it has dried off. So when you inject the needle to the catheter, you need to have sterile needle and syringe for this one. When you get a needle and try to collect urine from the catheter, you should always punch it from the head to toe direction. So this end, the tip end, is the one that is connected to the patient, and you direct the needle's tip towards the bag. So you can see here, now we should not touch the area that we have cleaned, and we inject the needle into the catheter and draw the sample of urine. And once we collect it, now needle is also there in the syringe. So now I'm going to demonstrate to you the single-handed scoop technique. So now we are going to put the needle gently into this and put it in, and remove the needle and put it in the sharps bin, and collect the urine sample into the sterile screw-capped container. So you should be careful not to touch the edges of the container and not to touch the lid, and then we seal it and have to dispose the syringe also. And now again we are going to clean the site thoroughly with 70% alcohol, so that we don't introduce any external organisms into this system. And then once it is over, dispose the cotton and dispose the gloves into infectious waste, and wash hands with soap and water. And then you have to label the sample with the patient's details and write the proper request form to go with this. Okay.